Rushanara Ali.
Thank you, Sir Christopher, and it's a pleasure to join this debate. And I want to congratulate my honourable friend, the member for Hammersmith, for securing this very important debate. The speed of the rollout of the vaccination programme is a great source of hope for all of us. Those of us who've lost loved ones are particularly grateful to the NHS, to the scientists, to so many who've come together to produce this vaccine, because we all know how important it is to protect our constituents and our friends and family. Locally, I want to pay tribute to my local authority that set up a helpline that's proactively contacting people who haven't been vaccinated and answering and addressing questions. Government resources will make a big difference to other local authorities to help support that effort. And we need that backup from ministers. And I want to thank the Royal London Hospital, Queen Mary University, GP surgeries, the London Muslim Centre and other partners who've been helping with the vaccination effort in my constituency. Many will be aware that Tower Hamlets has had in the first wave the fourth highest age standardised death rate in the country. And although we are a young population, relatively speaking, there are huge health inequalities and huge issues with deprivation, severe overcrowding, intergenerational households. Many of those factors that like other colleagues have said, make inner London extremely vulnerable to this pandemic. And in the second wave, we saw the spread of the virus cause more deaths. And that's why it's vital that we get to those who haven't yet been vaccinated, those who have underlying conditions, by increasing the supply of the AstraZeneca vaccine. And we get to those who didn't take up the vaccine when they were offered, for a number of complicated reasons, as other colleagues have mentioned. In some cases, it's reticence, but it's also about practicalities. It's also about deprivation. It's not just ethnic minority communities, although we've seen big differentials. Is those from white disadvantaged backgrounds, from working class backgrounds, who've been disproportionately affected, both in terms of death rates, but also where the take-up of vaccines are lower. So what we need to do now is make sure the vaccines are in the right places. So the centralized hubs are, of course, useful and important, but it's vital we get them to local GP surgeries. As I've said to the Minister time and again, we get more vaccines to pharmacies, we get more pop-up clinics up and running. The ones that we have are very good and very helpful, but the unpredictability of supplies, the inability for planning, the lack of local flexibility are all leading to suboptimal outcomes when we could have better outcomes. So today I call on the Minister once again to get the vaccines to the local providers, to provide local authorities with additional support so they can do the chasing, as in my local authority. And what we've seen is that when GPs are responsible for getting vulnerable patients, homebound patients, vaccinated, in my borough, 95% of them have been vaccinated. So this is not rocket science. We can address the gaps. I'm grateful to the Minister for the work he's done so far. And I appreciate that we have a listening ear in him. And I hope he listens to the arguments that have been made, not just by members in my party, but in his party too, that we've got to get the supplies in. Going forward, as other colleagues have pointed out, we also need to address some of the deeper underlying conditions and make sure that the vulnerabilities that people face are addressed. And one final issue, which is that Ramadan is coming, so we're on a race against time to vaccinate vulnerable constituents from the Muslim community in our city, because if we don't, then there are even greater risks. So I hope the Minister will address that point and the importance of getting more supplies into London.
Order. Fleur Anderson.
Thank you very much.